let's jump into our Q&A time. We've got about 15 minutes as we'd hoped. And Dr. Yadin David and Keiko, getting late for you there in Japan. What questions do we have from the crowd? Any opening comments, Yadin or Keiko?
Absolutely, Tom. Thank you. This was an excellent highlight and summary of 13 different webinars we presented together. This faculty is awesome. Some mentioned that they were invited on a short-term basis, but this is the world we live in. And we appreciate that you took the challenge and you're here today presenting excellent, very informative material from different aspects around the COVID-19. We're all celebrating today. I wish I would be in your little corner of the world with a piece of cake and a candle and maybe a horn to make some noise. But what I would like to do at this point is just open up the platform here and let the audience who were so patient express their comments and questions. How your world has been changed on a personal level as a clinical engineer.
So we're opening it up to the panel to respond because their mics are under their control, whereas the audience, not so much, but if you raise hands from the audience, we can try to help. So the mic is open for any of the faculty to respond to Yadin's comment. And Yadin, I'm looking for something to celebrate with.
Yeah.
I think for starters, I'll put on the hat you have, Global Clinical Engineering Alliance, that is a wonderful partner with Clinical Engineering Division, and we're going to do great things together. And that's going to explode out of the basement, using the metaphor of the morning, here at the virtual Congress coming up.
So what I would like to ask Dan, in a way of a personal favor, can you tell us more about the extremely high recognition you received for services you provided associated with clinical engineering and COVID-19?
Yadin, he doesn't want to because he's humble, but go ahead, Dan, do it anyway.
Yeah, thank you. You know, so I was awarded in the UK. It's an OBE, so that's an Officer of the Order of the British Empire. It is a distinguished honour. I was very humbled to receive it. There's a saying in the UK. There's an award that's called the MBE, and people refer to that as my bloody effort. And then there's one called the OBE, which is actually hierarchically higher, but people say it's others' bloody effort. And I think it's very much that. I'm fortunate, throughout my career, I've been incredibly fortunate to work in this field, and been surrounded by some fantastic individuals. And then, you know, the reason I was honoured by the Queen's Award this time was really the work of my team, of course. We did an awful lot of stuff, like an awful lot of clinical engineers all over the world. The reason I came to the notice of people in the UK is because Nottingham Clinical Engineering Service happens to be a very large service, and we stood up at the start of the COVID pandemic a technical due diligence service to look at all the new equipment that we could possibly use to support critical care in the UK. Lots of new equipment was coming onto the market, lots of new equipment we were bringing in from all around the globe, but it was alien to the UK, and it was alien to clinical engineering services across the UK. So we stepped up a service here to support the government in making sure that the equipment that we distributed into hospitals all over the NHS was fit for purpose, and that we could help clinical engineers across the UK adopt it and put it into clinical service. So I think that's why I came to the attention of those that make these awards. But it was so I was doing the liaison work with the government, with the military, with the logistics people, with the Department of Health. But the people that did the real work, of course, were the clinical engineers in my team, who were actually doing the technical assessments and finding out what equipment we could or couldn't use in the NHS. So yeah, I am truly humbled by it, and really do believe it represents the work of clinical engineers, not of Dan Clark.
This is fantastic, Dan. I just can give you a
Thank you,
hand
Yadi.
and recognize it. I tell all my friends that my good buddy in Nottingham just have 4 o'clock tea with the Queen and has a biscuit, and that's fine. Okay. I would like to just remind you all that what we don't do well is publish our work. We need to get into the habit of clinical engineers able to write a scientific paper and publish it. What other professionals doing in healthcare field, the cardiologists, the anesthesiologists, the emergency medicine nurses, the respiratory therapists, they all write about the work, get recognition, just like Dan is doing. And I think that we need to encourage each other for get down to the keyboard and write. It's not that difficult. And we do have a host journal, the Global Clinical Engineering Journal, that was created for us, by us. And I would like to invite all the faculty today to write a 2-page summary of their message today and get into a special issues. And I give the credit to Elliot for coming up with the idea. And we're going to be follow up on that, but beware that you're going to be invited, and please do take care of business this way. If I can, Tom, I would like to jump into another continent and ask Jintendra if he still have time before catching his plane. Is he on?
He might have caught a plane.
I think he might have caught a plane. Okay. Well,
But here's a continent, Western Pacific. Keiko, our co-moderator, any comments about what you've been hearing today? Is Japan celebrating?
Thank you very much. You know, I am so happy to be here, and I appreciate what you have done very much. You know, and Yadin asked us what changed after pandemic, occurred in Japan. I think people realize clinical engineer more because, nowadays, ordinary people know PPE and ventilator and ECMO and so on. Those, equipment is not familiar for ordinary people, but after pandemic happened and the people, knew those, equipment, and they knew, how important it is. It is not only the equipment, it also need human resources, who will maintain that, who will, operate that. And so I think, unfortunately, pandemic occurred, but, people recognize what is important to do, and especially, clinical engineer and biomedical engineer doing very well, good job, and that is, I think what we change in Japan as well. Back to
Great.
Tom.
That's great.
Tom?
Go ahead, Carla.
Oh, I just wanted to mention, and thank you, Nadine, for your call to action on, publishing, because we really need to do that. I would also like to invite everyone to do some writing on and publishing on thought leadership in the field and innovation. And it was very, very interesting to me. I didn't spend the time because I knew we, were running out of time, but I was approached by rural state departments of rural health, national health, every single employer in the United States, and I'm sure outside of the United States, health care became their #1 priority, the health and wellness of their employees, right? And their customers. I was contacted to give guidance to HR for all of Las Vegas and the casinos and help them source, PPE, help them figure out their infection control and their policies, their policies during this time. Walmart, CVS, the commercial industry all became healthcare, companies, if you will. And so there is so much opportunity for clinical engineering and biomedical engineering to participate, They don't know how to reach out and contact everyone, but I think that we can network this out and bring leadership skills to all these organizations and companies that it's really, really needed out there. And really, really happy to be a resource to help begin this networking.
Tom?
Will you unmute?
Hi.
Yeah, writing, connecting, we've heard there's so many ways we can contribute, being there on the, boots on the ground, like many of you are in your hospitals, making a difference. Then there's research, local and global research. Dr. Leandro Peck is here with us, and tell us a little bit about what you guys have been doing, Leandro.
Well, Tom, thank you for this question. And sorry, I'm in a train.
And he's the PPE expert, so he's demonstrating.
By the way, feed, breathability, and
Very good,
filtering,
very
as per David talk. So what can we do? We need to be more scientific, and then publications will come. So we need to adopt the paradigm of evidence-based clinical engineering, as many of our friends now recommend. And I know that Yadin is doing a great job on that. So keep pushing. If just we want to publish the data, the experience we are having, especially in those difficult moments, I think there is a lot that we need to share with our communities. And the research is nothing else than solving problem, which is what you do, guys. It's just the way you tell the story which makes the difference. So I completely endorse Yadin's points, and count on me for any sort of help. Thank you, Tom.
Tom?
Yes, Rosanna.
Yeah, I really enjoy and celebrate in this moment, not just the webinar, but all the knowledge, lessons, experiences, and also challenges we have shared and discussed in the last months. CD, IFMBE, GCA have made a difference, contributing to these dialogues and also to the motivation to all the global community in clinical engineering. I just want to add to the comments from Carla, Keiko, and Leandro, the purpose. Networking is highly required. Business model approach, whether you work in public health or in private healthcare services, business model approach is required. Keep being scientific research, make publications, also leadership. All these factors are valuable with the purpose. These difficult times showed us everywhere clearly what is the purpose: to keep working, keep making research, keep just being here to make and contribute to the difference. Individually, I will be 1 second selfish. I had the worst experience in the health of my family. And in the worst moment, I kept on the vision. I didn't lose the purpose. And it showed me amazingly that this is not just because of a certificate or a webinar or a Zoom. It has more than that. We are making difference globally. We are thinking not just in ourselves, but in the population globally, whether it's developed or not developed country. We are here to understand better us and to make things better for us. Thank you.
Thank you, Rosanna. Antonio?
Thank you, Tom. I want to bring to the floor, and I mentioned this before, 2 topics that will impact the clinical engineering community and the health technology community, and that we need to get involved and be very active. One of those is the nomenclator for medical devices. WHO, under the leadership of Adriana, is preparing a document to be presented on October to start the process to taking the decision of the World Health Assembly on the nomenclator for medical devices. Currently, there are 4 of them and a decision will be made how to move forward. This decision will impact deeply the clinical engineering activities. So I strongly recommend to join the work that Adriana is doing and collaborate in order to give some input. If we don't do it, some others like industry or regulators will do it. And the second one is also on the table is the decision of this year of the use of the International Classification of Disease, the IDC, moving from version 10 for version 11 that has been around for many years, but now all countries commit to use this version, and that will change in a way or impact ways of technologies select and use. So clinical engineers should be involved in what is going on at the country level in adopting or changing this, because it will impact from the computer system to the day-to-day work of the engineers. And last but not least, there's something that I have been advocated, is the need of this leader group to be more involved in public policy decision-making. We need to start joining at the country level those groups that produce what will be legislation in the different fields. Specifically, we need to reinforce the technology management and technology field at large. Thank you, John. Thank you all. It was a great activity today.
Very good. Yadin, Keiko, before we turn the mic to Elliot to close us.
Go ahead.
Take it away, Elliot.
So 20 years ago, I wrote an article called The Golden Age of Clinical Engineering, 2001. Here we are in 2021, and we are, in many ways, I think, realizing that article that I wrote about the convergence of clinical and informatics technologies, and not just the convergence of the technologies, but the collaborative community that you are witnessing by this Zoom meeting, where we have people from all over the planet talking about the progress that they've made individually and that we as a community have made. It is a golden age, and it is our opportunity, our privilege, our obligation to step up, step forward, lean in, and make this a better world in the year ahead and in the years and decades ahead. Tom, Yadin, Keiko, IFMBE-CED, thank you for hosting this incredible webinar. And Caleroy, thank you for your incredible stewardship.
We all raise a glass to our profession and to each other. Thank you, everybody. Celebrate with us. Talk to you soon.
Thank you.
Thanks,
you.
faculty.
Thanks, everyone.
Thank you.
Bye-bye.
Bye-bye.
Bye.
It was a
Thanks,
nice session. Thank
thanks,
you.
Bye,
Robin
everybody.
Hood.
Great job.